Marianne, how would you describe the status of medical supplies like masks and gowns around the world? We've heard all these warnings to the public not to hoard these type of things that they could buy at the store, so that there is enough for doctors and nurses. Is there enough? And are medical professionals having to go without it?
Well, we're clearly very concerned about the supply of the masks, the gowns, all the protective gear, and lots of healthcare institutions across the United States, and I think really across the world, are trying to figure out how they can use their supplies most effectively, because we do think that there are going to be some shortages of those supplies.
What do you think has been done to mitigate that shortage? Do hospitals, for example, have stockpiles of these type of things? We know that China is a huge manufacturer of these type of supplies and even medications. Right. So with all the quarantines that have taken place there, will factories in other regions like in Southeast Asia soon take over that role?
Well, I think that's a really good question. We don't have enough supplies here right now. There aren't great stockpiles. Certainly, health systems are really trying to use these supplies very judiciously. They're asking consumers not to purchase these supplies so that they're available for health professionals. And they're looking at some creative new ways to get supplies, particularly the masks and other protective gear for healthcare workers. The drug supply chain is another issue that is really of great concern here as well.
What about medical equipment like ventilators and other heavier types of machines needed in hospitals, right, especially when it comes to coronavirus? Any concern about those type of things?
Oh, absolutely. You know, again, it depends on how fast this spreads, what the peaks are. There certainly are not enough ventilators. If in the United States we have a huge peak like we've seen, for example, in Italy. And so much of the focus right now is on mitigation, on keeping this virus from spiking in terms of the need for the ventilators and the other specialized equipment in hospitals. We have some hospitals all across the country have set aside units and are preparing. But there is not really enough here if we have a major spike in need.
Right. What about places that are more rural or some of the smaller towns? Right. Can those type of things be moved from larger areas to accommodate for those smaller areas?
Right. It's a huge challenge. Again, there's some capacity in those rural areas, but not nearly enough if we have a major outbreak. And really, our health professionals, our public health system is really trying to figure out how do we protect people and how do we keep them from needing that specialized equipment.
As this virus moves and grows and spreads from region to region, as we've seen it jump, what are the challenges that are still out there when it comes to making sure that hospitals in some of these hard-hit cities have what they need?
So all the hospitals right now are focused particularly on getting enough test kits. One of the biggest challenges in the United States right now is to have available test kits so that the population, like in South Korea, can be identified early in the course of the disease so that people can be treated earlier and so that they don't progress to needing the ventilator equipment and other more specialized equipment. So the test kits is a major focus across hospitals, health systems, laboratories in the U.S. right now.
And are those still being distributed around the country? I mean, there have been, we've heard all these promises of millions of test kits being available by the end of the week. Yeah. I mean, are we going to see those soon?
Well, we don't know. They're not available yet. They're really trying to work on the issues that have kept them from being available. Right now, it is still public health departments that have to do the testing. It's very controlled and really quite limited. And hospitals and laboratories are trying to enable more of that testing to be done in those local facilities. So we're hearing that those will be likely available in the next few weeks, but not right now.
All right, we sure hope so. Marianne Udow-Phillips, thank you so much for joining us. We appreciate your time.
Happy to be here. Thank you.